Okay, let's just dive right into it. We're tackling one of the absolute most common, yet, least talked about questions when it comes to cosmetic recovery. Exactly how long do you have to wait to have sex after getting labial filler? It's a fantastic procedure for boosting comfort and confidence, but navigating the recovery, especially your intimate life, can really feel like walking through a maze without a map. Well, consider this explainer your map.
To kick things off, we really have to define what a labial puff actually is, because the specific material your provider used is going to drastically change your recovery timeline. We are not dealing with a one-size-fits-all rule here. Whether you got a specialized hyaluronic acid gel like Deserial, or you went with your body's own fat for a transfer, the actual physiological healing happening beneath the surface is what dictates exactly when you can safely get back to your normal routine.
So here's our roadmap for this explainer. We're going to cover the first 48 hours, the core question of resuming sex, compare the different procedures, walk through the steps for safe intimacy, and finally, talk about how to protect those results.
All right, let's start with phase 1, the first 48 hours. This is when your tissues are at their absolute most vulnerable. During these first few days of healing, experiencing mild swelling, redness, and a bit of bruising is completely normal. On day 1, your body is just reacting to the injections, so expect maximum swelling and tenderness. By day 2, things usually start to calm down, but your tissues are still actively integrating all that new volume. Then, by day 3, you're generally in the clear to get back to light, everyday activities, like taking a walk.
But listen, during this early window, you absolutely must avoid these immediate don'ts. Anything that increases blood flow, heat, or direct friction can be a total disaster for fresh filler. Why? Because a spiking heart rate from a heavy workout or the intense heat from a sauna will drastically magnify your swelling. Plus, activities like cycling or horseback riding apply direct pressure that can literally massage the filler right out of its intended place. And of course, skip the alcohol. It thins the blood, making you way more prone to prolonged bruising.
Moving right along to phase 2, which brings us to the core question of this whole explainer. When is it actually medically safe to resume sexual intimacy? It's the elephant in the room, and there's a certain irony to it, right? You just enhanced this extremely intimate area, but now you have to completely leave it alone. I know a lot of people feel too awkward to ask their provider about this, but remember, this is a medical procedure. Treating your recovery with precision is literally the only way to ensure those beautiful results you just invested in.
Now, to answer this properly, the road splits in two. The waiting period for standard HA filler is vastly different from a fat grafting or surgical procedure. Knowing exactly what your provider did is essential here, because the source material draws a very, very hard line between these two types of rejuvenation. So, if you received the standard hyaluronic acid filler, like Juvederm or Deserial, you must wait a minimum of 7 days before resuming sexual intercourse. Yep, that is 1 full week of complete pelvic rest. No exceptions.
You might be wondering, why 7 days exactly? Well, it takes about a week for that hyaluronic acid gel to fully integrate with your natural tissues and lock itself into place. If you engage in sex too early, the friction can literally massage that filler right out of place, which can cause permanent asymmetry. Not to mention, friction can introduce bacteria to the healing injection sites, opening the door to painful, complicated infections. 7 days just gives your body that uninterrupted time it desperately needs to seal everything up and secure the volume.
But hold on, because if your labial puff was achieved through fat grafting or paired with a surgical labiaplasty, that waiting period jumps drastically to 4 to 8 weeks. Yes, you heard that correctly, up to 2 full months.
The reason for this much longer wait is fundamentally biological. When fat is transferred from one part of your body to your labia, those newly moved fat cells are essentially on life support. They need weeks to establish a brand new blood supply just to survive. If you introduce the friction and pressure of intercourse before that blood supply is rock solid, you will literally crush and kill those transferred fat cells, completely undoing the whole procedure. And if you had a surgical labiaplasty at the same time, early friction can easily tear delicate sutures wide open, leading to wound separation, severe pain, and significant scarring. It is just not worth the risk.
Okay, let's move into phase 3, resuming intimacy safely.
Once you've successfully completed your specific waiting period, whether that was a quick 7 days or a full 8 weeks, how you ease back in matters. Step 1, always get the green light from your surgeon first. Step 2, when you are ready, generous water-based lubrication is going to be your absolute best friend. It significantly cuts down on the friction against your newly rejuvenated, very sensitive tissues. Step 3, start slowly with gentle contact.
Things might feel a little different or more sensitive down there. And step 4, if you feel pain, stop immediately.
Actually, I really want to highlight this quote from our source material because it hits the nail on the head. Pain is a signal, not something to push through. Pushing past discomfort can severely set back your healing and cause long-term complications. Your body is incredibly smart. If it hurts, it's just telling you the tissues are still inflamed or haven't fully settled yet. Take a break, wait a couple more days, and try again later. There is absolutely no rush.
Finally, let's wrap up with phase 4, protecting your results.
Let's talk about the return on your investment here. Sacrificing just 1 week of intimacy for HA fillers pays off with up to 12 to 18 months of increased volume, hydration, and comfort. I mean, a 12 to 18-month payoff for just 7 days of restraint? That's an amazing trade-off.
The big takeaway I want you to leave with is this. Strict adherence to your recovery timeline isn't just some annoying clinical rule imposed by doctors to ruin your fun. It is the ultimate protection for your investment. You chose to undergo this procedure to feel better, more comfortable, and more confident in your own skin. By simply waiting out the clock, you absolutely guarantee that those amazing benefits become your new long-term reality.
So it really all comes down to this one thought. Are you willing to wait just 7 days to guarantee over a full year of enhanced comfort, confidence, and intimacy? Understanding the why behind the wait empowers you to take complete control of your recovery. Respect the timeline, listen to what your body is telling you, and look forward to the incredible results waiting for you on the other side.